How you doing, Dr. Bob Montes? Just really talking a little bit about the fear in your child or your teen, and essentially just talking about anxiety issues. So today is part two of the whole process. Part one was some of the stuff we had already covered earlier with respect to having the child detect the issues inside. Um, we get an analysis or analogy of the fear. We move from there to helping the child use the fear technique, which is basically feelings and expectations, actions and results. Now we're into the part that could promote or provoke more anxiety in your child, but this is where the healing actually takes place. So in this part, we use the method of ERP, which is exposure with response prevention. What am I talking about? Don't freak out. Your child is going to be exposed to the fear-inducing issues. So what we do in the office when we make that happen is we have the child imagine themselves in fear-provoking situations. So that is done through a sort of visual imagery. Maybe we have them relax themselves 100%, and then once they're fully relaxed, we may begin to describe to them, hey, here you are in the fear event. So for example, in situations in which they are fearful of storms, say that child is with me, I might have the child just imagine that they're lying safely and calmly in their bed. They hear the slight rumbling of thunder. They begin to experience anxiety, but they begin to use their tools, and now they realize, no, this is nothing to be afraid of. I already know that I don't have to worry about that. Mom and dad are close by. I feel good. I feel great. So eventually what you're doing is you're exposing them to the situation, but you're doing it with the imagination. The part two of exposure is also to do it live or in vivo exposure. Now, in some cases, you can't create that. A storm comes when it wants to. But if you're talking about a situation where they're experiencing, let's say, social anxiety, then you want to expose them to low-level social issues, moderate level, eventually to high-level social issues. Now, this is idiosyncratic in that the child, him or herself, is the one who detects or determines, rather, whether or not this is low, high, medium, whatever. And so you have to work with the child in that context. If they're with a therapist, we would list it on the board and we would identify what is a low level anxiety versus a medium or high. Once the child is identifying what are their exposure levels, how much anxiety they can handle or manage, they begin to use the tools that we have taught them in those live events. Now, let's say, for example, a child is dealing with I don't know, social anxiety, speaking to adults, and they're just not very good at that. One way to expose them live to a situation might be that they could maybe take tickets at a sporting event, and they have to say hello to every person and then take the ticket or something like that. Or they could be in a situation in which they have to share with family members something they did that day, maybe at the dinner table. And everyone has to be quiet and let them speak. And they have to make sure that they make eye contact with all the family members. And the story doesn't have to be long. It just has to be maybe a 30-second thing. Hey, today I got to talk to two of my friends and we played on the playground together. So anything that actually puts them in a situation where they are, you know, in the live exposure. Now, there are some very difficult things to duplicate for them. That's why we do a lot of imagery in the office. But with some creativity and some effort, we can come up with ways to help. Now, one thing I want to just sort of leave as a caveat is that in the exposure discussion, if a child is fearful of being attacked or hurt, you don't want to have them be exposed to something of a level of intensity, but you want to look at the precursors to those anxious feelings and begin to expose some of that and then teach them how to reverse that using the fear technique. So obviously that would not be, you know, that's a different kind of situation that doesn't require the kind of thing I've just talked about. We'll talk on one more session about how we pull all of this together in the end. And I think you'll find it very helpful and rewarding also for you as parents. Thanks for your time. Stay tuned for the next video.